This video is brought to you by Global Men's Wellness, your 24/7 AI health expert. No copays, waiting rooms, or awkward conversations. Just real answers whenever you need them. Visit globalmenswellness.com to try it free and get your own on-demand concierge-level wellness expert today. Welcome to the Global Men's Wellness. I'm Dr. Judson Brandeis, and I'm so glad you're here. Today, we're tackling a topic that deserves far more attention: urinary incontinence after prostate treatment, or what we call IPT. Imagine surviving prostate cancer or benign prostatic hyperplasia, BPH, only to face the frustration and embarrassment of losing bladder control. It's a reality that affects a staggering number of men, yet remains under-discussed in both clinical settings and everyday conversations. Incontinence after prostate treatment is not a sign of weakness, nor is it an uncommon side effect. In fact, studies show that up to 25% of men who undergo radical prostatectomy for localized prostate cancer report bothersome leakage even 10 years later. Radiation therapies, cryotherapy, and newer options like HIFU can also lead to incontinence, though the timeline and severity may differ. The common thread is that IPT can diminish quality of life, delaying a return to work, hindering intimacy, and impacting self-esteem. But it doesn't have to be permanent. So what exactly is IPT? Think of your urinary system like a plumbing system. The prostate surrounds the urethra and sits just below the bladder. When that region is treated, either surgically or with radiation, the support structures and nerves that help control urination can be damaged. This often results in stress incontinence, leakage with physical activity, urgency incontinence, sudden strong urges to urinate, or mixed symptoms. Many men describe using multiple pads a day or avoiding activities they once enjoyed. But how does this happen biologically? Surgery can weaken or remove parts of the urinary sphincter, while radiation may cause scarring that affects both bladder and urethral function. It's like a miscommunication between the brain and the bladder, or a faulty valve in a high-pressure system. Certain factors such as age, prostate size, or nerve damage can increase the risk. Still, even younger, healthy men can experience IPT. Fortunately, we've come a long way in treatment options. Pelvic floor muscle training, PFMT, is the first line of defense. These exercises help strengthen the muscles around the bladder and urethra. When guided by a trained provider, PFMT can accelerate recovery, especially if started before surgery. For many men, this conservative therapy is enough. Others may need more advanced options, especially if symptoms persist beyond 6 months to a year. If PFMT isn't enough, surgery may be considered. The gold standard for moderate to severe cases is the artificial urinary sphincter, AUS. It's a mechanical device that allows voluntary control over urination. Most men who undergo AUS implantation report a dramatic reduction in leakage and improvement in quality of life. For those with mild to moderate incontinence, a male sling, essentially a supportive mesh under the urethra, can be highly effective. There are also newer options like adjustable balloon devices and investigational therapies under review. So why don't more men get help? There are several barriers. Many are simply too embarrassed to speak up. Others think it's a normal part of aging, or worse, that they have to live with it. In some cases, primary care providers may not ask about urinary issues. And unfortunately, insurance coverage, limited specialist access, and gaps in education can all play a role in delayed or missed treatment. Real-life experiences speak volumes. Men often describe the emotional toll of IPT, avoiding social events, skipping exercise, or feeling ashamed during intimacy. But once treatment begins, many express relief and renewed confidence. They return to work, rekindle relationships, and regain control over their lives. Treatment doesn't just help the bladder, it supports the mind, the heart, and the entire identity of the patient. At my practice, we take a highly personalized approach. We assess not just the severity of the incontinence, but also each man's goals. Some prioritize being pad-free. Others focus on restoring sexual function or avoiding surgery. We use imaging tools, pad tests, and sometimes urodynamic studies to tailor a plan. And we always use a shared decision-making model, because no one understands your life better than you do. When it comes to results, the data speaks clearly. PFMT can significantly shorten the time to recovery. AUS has high satisfaction rates, with many men achieving social continence, defined as using 0 or 1 pad per day. Slings are ideal for less severe cases and have excellent safety profiles. Even occlusive devices like clamps or external catheters can help in the right context. What about the future? We're entering a golden era of men's health innovation. Regenerative medicine, including stem cell therapies and nerve regeneration techniques, is on the horizon. Telehealth makes follow-up easier, especially for post-surgical care or therapy check-ins. Artificial intelligence may soon help predict which patients are at highest risk for IPT, allowing for earlier interventions. And wearable tech is being developed to track leakage patterns and support behavioral therapy in real time. I chose to specialize in men's health, not just to treat disease, but to restore dignity, energy, and vitality to those who've lost it. IPT may be common, but it's not trivial. It's a deeply personal condition that deserves serious attention. My mission is to make sure that no man suffers in silence, and no man walks this road alone. Help is out there, and recovery is possible. Thank you for joining me today on the Global Men's Wellness Podcast. I'm Dr. Judson Brandeis. Remember, healing doesn't stop when cancer is cured. It continues through education, empowerment, and compassionate care. There's a better way, and it starts with knowledge. Take control of your health anytime, anywhere. Visit globalmenswellness.com and start your free trial today. Get expert-level answers in seconds, not weeks, without the cost, the wait, or the awkward conversations. Real support on your terms. Visit globalmenswellness.com now.